Good afternoon and welcome. My name is Lynne Eckmann. I'm a pharmacist, a senior care pharmacist, and I'm going to be presenting today on medication adherence. Mark Huffmeyer, another senior care pharmacist that I work with and collaborate with, helped me put this together, and I look forward to sharing information with you today, and we're so glad that you could be here. So we have a couple of objectives we wanted to accomplish today. First is we want to cover the definition and the importance of medication adherence. This is a really big topic. We have a lot to discuss, and we want to have a better understanding what that really means. Then I would like to share some tips for promoting medication adherence, and then of course be available to answer any questions you may have about medication adherence. Once again, we talked about we want everyone to feel comfortable asking questions. You can just jot them down or type them in. We're going to get to those at the end, but definitely want to make this as interactive as possible, because certain things, I will cover that might bring a question. I want to make sure that we address those. So let's start with a little bit of terminology and background. So medication adherence, defined by the World Health Organization, adherence is defined as the extent to which a person's, sorry about that. Whoops, a little technical difficulty, I apologize. Okay, corresponds with the agreed recommendations from a health provider. So this is a little bit different in the past. A lot of times we use the terminology compliance, which was following medication instructions exactly as given to us. But now we refer to it as adherence. And that is more of a comprehensive approach to taking medications. And it involves several factors that we'll talk about in a minute. And why is medication adherence so important? Well, we know that approximately 50% of patients do not take their medications as prescribed. And this leads to a lot of negative health outcomes. Non-adherence causes between 30% of chronic disease state treatment failures. So the impact is far-reaching. And to talk about a little bit of how this complex behavior or complex adherence behavior is more of, it used to be kind of all put on the patient. So, but now we realize it's really a comprehensive, complex combination of, involving the patient, the providers involved, and then process components in our healthcare system. So things like the challenges in office visits where there's a time constraint and you only have so much time to visit with a provider. So those kinds of barriers can contribute to medication adherence problems as well. So we need to look at it from a lot of different angles, because it's not all on one component, it's a mixture. So let's talk a little bit about the importance of medication adherence. Taking medications as directed ensures that we're going to have more consistent medication levels in our body. And this can help control symptoms, can improve health outcomes, and allow you to get the maximum benefit from the medications. And taking medications as directed helps providers make informed decisions for evaluating treatment success. So if someone's coming into the office for a visit and they're reporting that they're taking their medications as prescribed, then the providers are making decisions based on the information that's being delivered during that conversation. And so if they feel like they need to make an adjustment based on, say, lab results or blood pressure recordings that they're taking, if they're not making adjustments on valid information that's being shared, then those can create negative impacts and affect, treatment success. So we need to make sure that we're conveying exactly how we are taking medication so that those adjustments and informed decisions can be made on correct information. And then I just wanted to point out briefly that not all medications are intended for routine use. Some medications are indicated only for as needed for certain situations. And what I see most often is we have labels where a prescription is, prescribed, and the directions from the provider initially are, take one every 4 to 6 hours as needed. Well, at the time, you might correlate that with whatever's going on and understand, well, this medication, for example, is for pain. But then we, 6 months down the road, or let's say you're helping a loved one and you're coming in to help them and you don't know what that medication is for because that indication is not listed. So I certainly am an advocate for, trying to help us ask providers to indicate that on their original prescriptions so that we have that printed. But then I certainly have, recommended people add indications onto labels, whether it be, via Sharpie or something on the label to indicate what that is to be tied to, for what reason, to clarify that indication, because that's very important. Because that can, if we're giving it for something we think is for a reason for other than what it was intended, that can cause problems as well. So let's talk a little bit about consequences of non-adherence. So lots of studies out there to show that poor adherence to medications can lead to a wide variety of negative health outcomes. We can have, for example, worsening of disease, a lot of different disease states that can be impacted negatively. The worst case scenario is that it could lead to death. And then we have the factor of a negative outcome of increased healthcare cost. And when we think about healthcare costs, it's important to think, this is not just in addition to the individual healthcare costs. So for example, a person ends up falling and they end up in the hospital, then they are going to, have related costs to that admission on a personal level, but we're also going to have an impact on, the overall healthcare system. So, which is something we all pay for, as far as, our Medicare beneficiaries, that we're all paying into that system. So it's important to realize that those negative, healthcare costs, or the costs that we incur, are not just on an individual and personal level, which, can be very devastating, but also on an overall healthcare cost. So that's another reason that this topic is so important. Oops, sorry. So this slide, I put in there to think about what I call the cascade effect. And an example would be, and this just happened recently, that I had a person referred to me, and they had been taking double the amount of blood pressure medicine that they were supposed to take. They were confused, forgot that they had taken it, were taking double dose, had actually filled their med planner with a double dose. So had a very low blood pressure, and the cascading effect is what I say. Okay, so let's say we take double blood pressure medicine. Well, the effect of that could be dizziness, so an increased risk of fall. So the first cascade effect is, they've had a fall, and let's say they had a fracture from that fall. Well, then they're going to need, medical care. So they're going to be, sent to a medical facility for evaluation and treatment. Well, let's say they required surgery. So that's an additional part of that cascade effect. And then after the surgery, they're going to need rehab. They're going to need to stay at a rehab facility so that they can, build their strength back up and learn how to, adjust from the injury and mend and recover from that and, try to get to where they can become independent again. So they're going to have that stay. And then there's going to be that transition of care, hopefully back to their original level of care, but often, unfortunately, we see a cascade effect to where they may lose some of that independence and they may need to be placed in a higher level of care. So just like with water, the power of water is a very strong force. And so this cascading effect, can have just, a tremendous trickle down effect from one original point. And so that's what I just try to use as far as understanding that the consequences, can be many and far reaching from this. So let's talk about some reasons for non-adherence. And I usually don't put this many things on a slide, but I actually wanted to leave it that way because it kind of helps us understand the depth and breadth of the subject. There are many, many reasons for non-adherence. And so I think it's important to, point out some of these that contribute to this, because we mentioned before, there's a lot of different factors involved, and just want to go over a few of those. So one, medication costs are a big reason that can be a barrier to taking medicines correctly. The provider, prescribing that medication, a lot of different Medicare prescription drug plans can have different tiers, different copays. So they might not realize, how expensive a medication copay might be for a patient. So this barrier of medication costs can certainly lead some people to say, I can't afford that medicine. So I'm just not going to get that prescription filled. Or maybe they got it filled the first time, but realized that they can't afford that moving forward. And let's say their follow-up appointment isn't for 6 months with their provider. So then you can potentially have, a gap there where they don't feel comfortable calling into the provider, or the phone tree to call into the provider is so challenging that, for the next 5 months, they don't take their medication because it costs too much, but they may not, have that follow-up until they go in and tell them on that next visit. So that is, definitely a gap in care that could contribute to, a major problem. A lack of understanding of their disease. This is something that I am an advocate for, something we need to do better as a healthcare system with explaining overall information about their disease state and long-term, potential consequences of disease state, so that we're better informing everyone about their health and having people feel more comfortable asking questions. Certainly want to be a promoter of us being, doing a better job to share information and for people to feel comfortable asking these, asking questions, because it's a shared process. Lack of understanding of medication instructions. This, the way we word things, the way that we communicate this, whether it be on the, original prescription drug label or how we've reviewed that with the patient, that we need to do everything we can to make sure, whether it's the patient themselves, a caregiver, a loved one. And I certainly want to do a shout out to understanding that there are many, many people helping people with medication. And I, appreciate everyone and they're assisting others to help them try to be adherent. And that can be in the form of a parent. It can be, nieces, nephews, grandchildren that are helping, neighbors, friends. So I certainly want to make sure that everyone, we need to recognize there are so many people that are trying to help someone, and we need to figure out how we can help them help their person that they're trying to help. So memory impairment can definitely contribute to the inability to take medications correctly, or to overtake or undertake their medications. So that definitely, adherence comes in a lot of different ways we talked about, but, overtaking medication can be as, as detrimental as undertaking medication. Lack of involvement in the treatment decision-making process. So this kind of ties back into the understanding of disease. So, a shared process of understanding that we need to be making decisions along with patients and coming up with treatment plans, because that's going to improve our overall adherence outcome. Poor health literacy. So the inability to read or comprehend this health-related information contributes to non-adherence. So are we getting our message across? Are we able to, convey the instructions in a way that we can relate to, this specific person? We may need to adjust that to help that outcome be better. Then we have patients' health beliefs and attitudes. Those are shaped in a lot of different ways and can be, shaped for over many years. So we need to be respectful of that, and we need to make sure that we have allowed them to, share those concerns or their thoughts, so that we can try to figure out, sometimes it's more of just being able to answer, a question, or to provide some more information for them to feel more comfortable or to understand. And then previous experience with medications. So this can be them, through their personal use with medications, a negative experience in the past. It can be a loved one that experienced a bad reaction, or, a experience with a medication. I certainly have many examples of that. I actually had a patient, 93-year-old lady that we were recommended to help with adherence concerns. Came in, and part of my practice, what we do is we go and we go into the environment, and we go to see the patient directly in their own home or where they live. And we can learn a lot in that scenario as far as, understanding more and learning more. And this patient had a stack full of like 17 weekly med planners that had been delivered to her, and they were all completely full of medicine. So she had someone organizing it, delivering it, providing it, but yet that adherence factor still was not, happening. And so it was over discussion and time to let her share her experience of a negative association with medication, because her loved one had, her sister had gone through some health problems, and she had been treated for cancer, and she had watched, and been a part of helping to care for her. And so she just built up this negative association with medications kind of as a whole, and had that something we worked through over time, and just even helping her work through that process, and then reviewing, that, we listened to her, and that we understood, where she was coming from, but we also wanted to go over, her specific conditions and the medication she took, and to help her understand of why she needed to take those and how that would help her quality of life. That, we got to a place where she actually was adherent with her medications. And so, we were able to work through that and go from that negative to that positive. Physical challenges, and this can come in a lot of different ways, but for example, someone with vision impairment. So they are unable to read labels. They are unable to, organize their medications because they are, challenged in that area. So we need to be looking for ways to help those people work through those, but that can contribute to non-adherence. And then treating conditions with no symptoms. So some symptoms or some conditions or healthcare disease states, we don't necessarily have, symptoms that make us feel like we have a problem. So therefore, when we take the medication to try to help, decrease, negative outcomes over years, that, that direct cause and relationship, it's not so visible, and they're not feeling it. We need to make sure we're explaining the long term, the big picture of why it's important. And then lack of transportation can also lead to non-adherence. So inability to pick up their prescriptions in a timely manner, to get those delivered, or to get access to those prescriptions on a timely manner. So that's can contribute as well. Long wait times at the pharmacy, especially in the time of COVID. We don't want to be spending as much time as we can limit in public. Those kinds of things can contribute to people not wanting to maybe go pick up their prescriptions. So we need to recognize that as a non-adherence and figure out how we can work around some of those challenges. And then lack of family or social support. So someone that doesn't have that direct, or those people that are helping to support them, can definitely decrease adherence patterns. And then poor mental health contributes to non-adherence. And that's another issue that we need to make sure that we are, supporting people and getting them the help that they need, because that, can affect, we want to help them get better mental health, but then, it also contributes to negative impacts on other disease states as well. So I know that's a lot of information and a really big amount, big slide, but I certainly feel like the importance of understanding, how varied and the reasons are, and that we need to, be looking at these on an individual basis. I can't stress that enough. Each person's situation is different. Their abilities, their challenges are unique, and we need to be working through those on an individual basis to see how can we help, this specific person given their specific circumstances. So we're going to talk a little bit about, different factors related to taking medications. Timing of medications can be very important. Trying to make sure that we've identified the best time to take a medication. This can, look different for different medications, and it can look different for different people taking medications. And that's important too. For example, a person might be taking medication in the morning, and after discussion and listening to, certain effects they may be having, or how they're functioning, or how they're able to remember to not, able to remember to take it at a certain time, well, then maybe we need to reevaluate. Could it be appropriate for them to take it at a different time that might increase their ability to take it on a regular basis? Those are important things to be able to discuss, because it certainly, certain medications we can move around and take at a different time, and that might, help their adherence pattern go up. Food versus an empty stomach. So this is a really, big one, because, stomach or taking meds with a full stomach or empty stomach, there's a lot of medications that food really doesn't impact the way they are absorbed or work in the body, but there are many other medications that it can make a difference. Sometimes it can increase the absorption of a medication. Other times it can decrease the absorption of a medication. And so to make sure we're, verifying those, if that medication or medication that you're taking, that we're looking to help figure that out as far as scheduling. And we need to, do we need to separate out medications from others? It's very important to separate out. A lot of times you can take, multiple medications at the same time. So when we're looking at trying to help with, creating a medication schedule for someone, this is important. Trying to simplify things as much as possible. I've certainly, work on trying to individualize dosing schedules and making to where we can, make it work for that person and given their lifestyle, because, not taking medications consistently, as we talked about, just can cause a lot of negative consequences. So I get this question a lot: what if I forget to take a medication? This also is medication specific. For example, if a medication is a once a day medication, then let's say you normally take it at 9 o'clock in the morning, and at 11 o'clock that morning, you realize you forgot to take it. So at this point, is it better to go ahead and take it, or is it better to wait? So for example, that on that situation, if it's a once a day medication and there aren't any specific reasons that you couldn't take it at that time, then it's better, for the most instances, to go ahead and take it. If it were a medication that, was taken 4 times a day, then, usually it would make sense to not play catch up, and that you're going to wait until the next dosing time to get back on schedule. But it's an individualized thing, but certainly recommend a call to the pharmacy. We should, be there to answer those questions for you to help figure that out on an individual basis. And then what if I'm not sure what time to take a medication? So this, kind of ties that to what I mentioned before. So if you're not sure, then definitely we want to be asking the question for us to figure out the optimal time to take that medication and how we can incorporate that in with the current medication to promote adherence. So safety and efficacy. Everyone reacts to medications differently. We process medications differently. We all have, there's genetic differences that cause us to process medications, absorb medications differently. So it's really important that we respect that, and that, if we all take a medication, we're all going to have, potentially a different reaction or outcome from taking that medication. So some medications, work better for us than others, and for other people, whatever works for you may not work for me. So it's important not to hop on the train of, well, this medication is great, so it's going to be great for you, or I had a terrible reaction to that medication, so it's going to be a problem for you. So I just want to explain that it's really important that because each person is different, and medication factors are present as far as the way we take medications and in our bodies and process them, that we're all different. So we need to respect that, each person, we need to evaluate them individually. And that it's important to understand medication, we can respond differently over time. So as our bodies get older, our bodies change. And it's important. A lot of times I'll have someone say, well, I take this medicine for 30 years. And I've never had, I'm sure it's not the medicine that's causing that. Well, 30 years ago, your body was 30 years younger. So it's important to respect the age-related changes that can happen, and to understand that our bodies might not be eliminating that medication as quickly. And so we can accumulate some of that medication. So those levels are going to go up in our body that might be causing some of the symptoms. So we always want to look at medications potentially if something has changed in the way you're feeling or what's going on, to make sure we're looking, is it possibly a medication-related effect? One point I wanted to make also is that we don't want to be treating medication-related effects, let's say an adverse effect, to treat with another medication, because it's, an adverse effect from another medication. So that is a whole nother topic, polypharmacy, where we can, keep adding on other drugs to treat adverse effects or side effects of a medication. So we want to make sure that we are, evaluating effects, and to see if it, could potentially be related. I had this happen actually just yesterday. I had a family member reach out to me and ask for an antidiarrheal for a patient, their loved one, and looking at their medication list and asking some more questions. I have 2 recommendations that I'm currently running by the provider. One is to look at changing the formulation of a medication that she takes to an extended release version, because it has much less chance of causing diarrhea in that formulation. and then potentially looking at adjusting a dosage on another medication because it could potentially be contributing it. So to look deeper into things when we have issues going on to see, you know, could it be related to another medication they're taking, and try to problem solve that way. So to talk to your provider or pharmacist is about any concern is recommended, because these are how we, you know, try to problem solve through these types of scenarios. I do want to point out, definitely don't want to share medications with anyone. It's actually medications that are prescribed for one person are indicated for that person only. It's actually illegal to take medications that are prescribed for someone else. So it's very important. And I actually see this in practice where, you know, friends are trying to help friends, and that can get really dangerous. And so I just want to mention that, as we do not want to be sharing medications with other people. Crushing medications is another topic that I could talk quite extensively about, but just for the sake of time, certainly one time I had a provider tell me, you know, I recommended, you know, we do not crush this medication. And this was in a long-term care patient, when the provider said, of course you can crush it. And, you know, was physically demonstrating or telling, you know, the personnel that they could do that. But you could physically crush a medication, but it can actually render it to be to where it would provide too much medication in the body at once, or it could render it inactive. So just because a medication is physically crushable doesn't mean that it is not causing other problems. So it's very important that we're verifying if a medication can be crushed, or are there other alternatives that we can look for. An example I had 2 weeks ago was I had a Parkinson's patient who was having a hard time swallowing medications. One of his pills was very large, and in the discussion with him and his daughter, you know, they shared with me the struggles that he was having taking this medication. Fortunately, was able to reach out to the provider and evaluate a different medication in the same class to an equivalent dose. And so we were able to get that changed, and has really made a huge change in this scenario for him, because now at nighttime, he used to dread taking his medicines at night because he struggled so much with swallowing this large pill. And now he's able to take the much smaller version or medication without a problem. And so that's certainly something that we talked about can be an adherence barrier, but if we can problem solve through some of those, can really help with the adherence factor. Also important to not just stop or adjust medications on your own. We certainly want to be communicating with providers to let them know that whatever is going on, whatever issue that you're having or concern that you're having, those need to be discussed, because some medications, it can be very dangerous to just stop, what we call quote unquote cold turkey. So just stopping it, completely dropping it. And we need to make sure that we're safely figuring out how to come off of that medication or make an adjustment or reevaluate therapy before just changing something. So a little bit more about cost. Prescription insurance, we have private insurance, we have a lot of different insurances, but this is just a basic overview. Medicare D or Part D. The D is for drug. This is the Medicare beneficiaries drug coverage plan that most people over 65 have. Most people with a Part D plan have a deductible, but some plans are made to where they don't have a deductible. Their co-pays might be a little bit higher through the year, but they're not having to incur that, upfront, and it could be up to, somewhere around $400 at the beginning of the year. So that's just something to keep in mind when helping, if someone is looking to choose a plan, to look at that or understand how that works. And then the donut hole is actually, and I'm not going to spend much time on this, actually this year that has been what they consider phased out. So this is something that we spend up to a certain amount of money out of pocket, or the combined out of pocket and insurance expenditure. Then you went into this gap coverage where you your copays were even up to 50% at one time. So you could go from reasonable monthly copays to this this gap in coverage where your out of pocket expenses greatly increased. And this is something they've phased out to try to make the the medication copays affordable throughout the whole year. So talking about expense, how can we problem solve through some of the barriers with, expensive medications? Well, it's important to, to let someone know if it is too expensive, not to just stop taking, but to let us know the reason that you can't afford this medication. So can we look for other alternatives? Are there programs that we can look into for patient assistance? Are there medications that we can change it to that, still could potentially be therapeutic and work for that patient, but aren't quite as expensive? And certainly don't recommend changing or finding it from an alternative source or just self-adjusting that medication. So for example, don't recommend, taking, I'll take half a tablet every day, or just half, or take it every other day to save money. That can lead to, other problems. And we talk about the cascading effect for trying to problem solve yourself, but we need to look at it from a comprehensive approach and figure out a better plan overall. Unfortunately, with our Medicare beneficiaries, that coupons most often do not apply. There are a few instances where they can be maybe used at the beginning of therapy, but that's something that's I'm not going to get into, but that we need to be looking to see if someone brings in a coupon, that we need to be able to explain for certain Medicare beneficiaries and for certain insurances that those will not apply. So we need to look at other alternatives for addressing medication costs. So talking a little bit about medication adherence tips. So there are many, many different types of adherence containers and electronic versions. They come in all shapes and sizes. And certainly my experience over the last 30 years, some that I've seen, work well, but again, I think it's important to individualize this process and to reevaluate when we notice the plan is not working. So I've shown you a few here. I certainly also want to explain that the medication planners that in my opinion, that allow where each dosing time is stored together and they're removable from the box. And actually, I'm sorry, I don't have a picture on the slide of that, but tends to be easier for people to handle. When the planners are all like one piece and they're having to manipulate the whole package and turn it upside down to dump the medicines out, that creates problems as far as dropping pills, and can definitely create for people that are challenged with fine motor arthritis, things like that impacts their ability to use those containers. So we need to be making sure that whatever we're choosing, that they can actually handle. So when we're kind of testing something out, then we want them to be able to demonstrate back to us that they are able to handle that. So what we call like a teach back method, to where we know how they want them to use it. Maybe we're helping someone, then we want them to be able to show us that they are able to show us, for example, say, well, okay, where are you going to take your medication tonight? Where are you going to start with it? If you're, starting with an evening dose, that they can show you the correct slot or container that they're going to take medication from to ensure that they understand, and they might shake their head and tell you that they understand, but they need to be able to demonstrate that they actually comprehend and understand. Some of these electronic versions, I certainly have used a unit for the past 15 years that I feel comfortable with, to where it's, it has an alarm on it. It rotates in the medication that's due at that time. It's programmable up to 4 times a day, but there's lots and lots of different versions. I certainly, some are much easier to load and to program than others. So it's important. Certainly, my contact information is at the beginning of the program. I am always available and love to talk to people about if they're looking into something to try to help them choose what might be best for them. I certainly have also had people come to me and I've shown them how to use a certain type of system, so to try to help support them through the process. But adherence packaging or medication management services is another potential solution to helping someone that's struggling with adherence. A lot more pharmacies are offering these types of services, but they're all very different and they offer different levels of support. So it's important to ask the questions to understand exactly what you're getting for that type of packaging service. We want to make sure that, we are involving caregivers, that we are, keeping everybody educated on a plan that we've determined to try to help someone, to get a plan in place for their daily routine and, keep it in sight. Once again, this is definitely needs to be customized and individualized, but trying to make sure we're promoting adherence for that individual person. So, for example, if we have it in a certain place of the home and we're realizing that this plan isn't working, that we need to figure out, well, maybe we need to move that and try a different plan. So trying to solve the root of the problem. Is it because we're not, we're not locating in the best place in the home to promote that adherence, or is it because at that time of the day, let's say we have an alarm set for their morning medicines and it turns out they're sleeping right through that alarm and they're missing that morning medicine, then maybe perhaps we need to adjust the time on that alarm and move that, a little bit later in the morning and then monitor to see if that makes a difference. So there's also autofill programs, sync up programs at pharmacies. I don't want to, I want to make sure that I don't say this is for everyone, because, autofills or automatic fills can cause their own set of problems as far as, if medications are on autofill and a medication gets discontinued. And so if it's not taken off of autofill, then you can be having medications refilled and delivered that can create more problems. So it's important that we need to make sure that that sync up program or autofill makes the most sense in that scenario. Pill burden, we talked a little bit about timing of medications. Pill burden is an area where we, if we're spacing of medications, let's say a lot of times medications get, once a day, take 1 tablet by mouth daily and 1 capsule by mouth daily, and they all kind of get just, automatically put in the morning container. So let's say you're taking 9 medications, or a person's taking 9 medications in the morning and, 1 medication in the evening. Well, taking all of those pills in the morning for some people is overwhelming. And that's where we look at, are there some medications that we can move around to try to spread that out a little bit? Can we combine dosing times to decrease that pill burden and make it more of a schedule that we can adhere to? And so anytime we can reduce the times of medication that people taking medications, that for a lot of times that will increase adherence by reducing the chance that they're going to miss those medications or being overburdened with taking medications so many different times a day. So my communication and teamwork slide is, I want to just take a shout out to, everyone helping someone with medication and their adherence. We have our healthcare team, which we are grateful for. We have our non-healthcare team members, which we're grateful for. And we need to all be working together because it takes all of us working together to promote, positive medication adherence outcomes. It is not a one-person job. It is all of us trying to problem solve together. This is something that I'm passionate about. I am passionate about promoting and to helping us to get to where we're working more as team members to help people adhere to their medications. So next step, I'm going to go over this briefly. I know we're getting close to time. I know we want to do some questions. So it's important to come up with a plan. And then once you establish a plan, to implement it. And then of course you have to monitor and make sure it's working. If it's not working, we get to this reassess. Well, if it's not working, then we need to readjust. If it's working great, then we need to continue. So this pattern of going through here and readjusting and monitoring and follow up is something that we need to stay on, forever, because the plan might work for 2 years, and then we maybe someone with cognitive decline, and we've gotten to a new level where this is not working. So we need to readjust and come up with a new one. Drug and diet interactions, just for the sake of time, I'm not really, going to go over this, talking about, certainly medications, and the more we take medications, the more chance for drug interactions. So we need to make sure that we are having our providers and pharmacists look into those, that we need to be sharing our information, everything that the person takes, including supplements and over-the-counters, to evaluate the safety of medications working together. And then our dietary considerations with medications is something we want to make sure that we're evaluating as well. Drug disposal, this is something that we're doing a better job in our communities. Actually, I know at our pharmacy, we've installed a take-back bin to where we have more local access on a anytime basis, or when the pharmacy is open, to be able to drop those off and dispose of these safely so that they're not going into our water system. There are certainly take back events that we have, Kentucky American Water here in Lexington, but certainly other surrounding areas or wherever you may live. We need to, those events usually take place in April and October, but may be different for different communities. So for safety at home, there are we want to make sure if there's something that we need to be disposing of in sharps containers or the biohazard containers, that those are done safely. And then if you don't have access to drop those medications off for take back and disposal systems, that used coffee grounds and kitty litter can be a source of disposing of medications safely. Tips for being a great patient or someone helping a patient. Always carry an up-to-date med list, including all over-the-counters, medications, and supplements. Be an active participant. Ask questions. Be truthful with providers on information regarding adherence. Talk to your pharmacist. Make sure that you're reporting adverse effects and you're following instructions, or if you can't follow instructions, to ask the questions to figure out what we need to do moving forward. And tips for prescription fill process. So utilize the curbside service if it's available and helpful. Try to find low traffic times in the pharmacy so that you could have shorter wait times or have more one-on-one opportunities to discuss things with the pharmacist. If possible, make an appointment so that you can spend some designated time to where we can really have time to talk about questions and about medication adherence or anything going on. Transitions of care are a critical point for medication-related problems. So we need to make sure that during those transition times, coming out from a rehab facility and going back home, coming out from the hospital and going back home, that we are having our pharmacists work with the discharging facility to make sure that we are all on page with the plan moving forward. Call ahead to make sure prescriptions are ready to be filled or to be picked up, sorry. Sometimes prescriptions need clarification, so we've made a phone call to do that. Sometimes they need prior authorization, or that maybe we need to order that medication because we don't have it in stock, or a medication that's very expensive, then maybe we need to look at alternatives. So we need to make sure that we're addressing those and that we're not coming to the pharmacy unnecessarily. Additional thoughts, create a routine. Often people that need help are those that resist help. So we need to draw the line on safety when a person is a danger to themselves or to others. That we need to, during medication, taking time, that we're limiting distractions, that we're providing the proper support, that we're simplifying routines as much as possible, that we demonstrate respect, that we're practicing patience, and remaining persistent on follow-up. Because someone might tell you that they're doing fine and they're taking their medicines correctly, but so many times that we discover that they're not. So we need to be persistent in that follow-up and making sure we're verifying and trying to problem solve through any kind of concern with adherence. I've listed some tips. There's lots of resources available through the FDA, but I think I want to thank you for your time and attention. I'm here to answer any questions that might have come up during the presentation.
Hey, Lynn, it's Terry. There is a question going back to the timing is key slide. Someone typed in the question, what about an Alzheimer's patient who doesn't have a good sense of time or does not have a regular sleep pattern? This is when you were talking about, the timing of taking meds.
That is a very challenging scenario. Certainly something I'm working through with someone right now to figure out how to best navigate that, as there's no one set answer. So trying to establish some type of routine and certainly trying to make sure, like I said, if it's a once a day medication and their day doesn't start until the early afternoon, then we need to be looking at, well, is it appropriate? Can we give these medications and change the time? That not everybody's daily medication needs to be taken at 9 o'clock in the morning. So looking for what is their pattern. We need them to provide the information on, what a typical week looks like. Not that, every day is different and we respect that, but at the same time, kind of looking at overall patterns of how they, live, during or carry out their daily routine or lack of routine, but it's to get more information on that, to look at the overall picture over a little bit of time, to try to problem solve and figure out, okay, here's what we're looking at. How can we, try to establish some routine in here to figure out, the optimal way to get their medication adherence up. And, that's something, like I said, goes back to that individual basis. And, do they have a caregiver that's coming in daily? Do they have a loved one or, someone that's checking on them? Like, how can we incorporate that timing? I had one, patient who, we ended up, the medications, the daily medications, we changed to extended release formulations and we dosed in the evening because our adherence was very poor. And by looking at, can we look at these medications and will this work to change this to, dosing these medications at a different time of day, and that we were able to problem solve through that.
We have another question. How do you respond when someone says, I already took them?
Well, that goes back to the patience key that I pointed out. Trying to be firm. I certainly have it come up a lot where someone is, pushing back and certainly understand, and like I said, respect. Sometimes you just kind of have to put a pause on it and come back a little bit later and try again. But reasoning, people say, you try to reason with someone. Well, in certain instances you can, but in someone at certain stages of cognitive impairment where they're not able to process certain things, that they're trying to reason with them is usually not going to be a positive outcome. So we need to, like I said, to get on that routine, that persistence. It's kind of a patient but persistent approach. And then, like I said, to not force it, that at some point you need to, step away and retry that again a little bit later. Certainly something I'm working on right now with Dementia Friendly Lexington, that we're looking on creating tips to help caregivers and tips for pharmacy staff to better help persons living with dementia and their caregivers work through some of these challenges. So it's something we're brainstorming on and working on, trying to come up with some tips on that. So that'll be coming up soon.
And another question is, how do you help those who refuse to use a pill planner or does not like someone checking in on them, especially those with mild AD or in transition?
Well, once again, that is a very challenging scenario. There are no perfect answers. And that's where I kept saying that your pushback is usually going to be the greatest from people that need it the most, that support. So that's where it becomes that, trying to evaluate, safety to themselves and to others. And that is where it gets to where you're, whether you're concerned about that, then it's time to try to reach out for, resources and how to work through that, because this, comes up so often, and trying to bring someone else into the picture that maybe can help through that. Believe me, in my practice, I meet a lot of people that don't really want me or want my services on board at the beginning. And it takes time to work through some of those challenges and try to get to a better place. So trying to let someone know your concerns, share with a provider, because they might be able to recommend a service or, a consult to where we can try to work through some of these, because you need some help, you need some support, and we need to try to help come up with a plan, because trying to work through that is going to take some, evaluation of some, definitely the overall picture and specific information, and then figure out, okay, well, here's a plan we can try, and then, reevaluate if necessary. But I definitely, if you're concerned, we want to make sure that you're trying to reach out to try to get some help on that, because you can tell, there's a problem, and we need to try to figure out how to best navigate through that.